Steve Brine.
Thank you very much, Madam Deputy Speaker. It's a pleasure to follow the Honourable Lady from Blaydon, who I have been questioned by many times. Thinking about today's debate, it was early summer 2017. I was standing down there at that dispatch box answering health questions, and I remember I was being pressed by my then shadow, the lovely lady who represents Washington and Sunderland West, as to when I was going to publish the long-awaited tobacco control plan, which, as the Honourable Lady for Blaydon reminds us, was due to be out in December 2015. And rather to the surprise of my shadow that day, and I have to say the surprise of my official sitting in the box, I said that it would be out before summer recess. And true to my word, it was. Now, it was an early lesson for me in how to focus the minds of the civil service, because I've never seen them move so fast. But more importantly, it set out some of the key ambitions for us to hit by 2022, and then the Green Paper, the Prevention Green Paper, a few years later, set the course for England to be smoke-free, of course, by the date of 2030. And I have to say that there are ambitions both in the plan and in the Green Paper that I stand by 100%, and they're ones that I believe with all my heart are completely achievable. But we're going to have to get our skates on, as has been said by the first two speakers. We're going to have to be very bold. We have to make the most of the opportunity, one of the rare opportunities there are afforded to us by the COVID pandemic. So just a few points I want to make today, Madam Deputy Speaker, if I may. First, public health reorganisation. I have previously raised my concerns in the House about the future of Public Health England's work to tackle issues such as smoking, obesity, inequality, air quality, after the new Institute for Health Protection comes online. I have no issue with the desire to take the health protection functions out and create the new institute based on the German model. I have no issue with that. It makes a lot of sense, and I've said so to the Health Secretary in public and in private. My concern is about the health prevention parts of Public Health England. Indeed, on the 1st of September, I asked the Secretary of State whether he was considering bringing Public Health England's expertise and significant experience in this area back into the department. Whenever I was travelling abroad representing the government and I needed briefing on these issues, I always knew there would be somebody who knew infinitely more than me inside Public Health England. I do not want to see that wasted. So I note that the department has now established a programme of work to pick through this, and the snappily titled Population Health Improvement Stakeholder Advisory Group has been formed. And there are some notable names on there. Seema Kennedy, who is my successor as the Public Health Minister, Professor Helen Stokes-Lampard, formerly of the Royal College GPs, of course, now chairing the Academy of Medical Royal Colleges. You've got Professor John Newton from PHE. You've got Dr. Jenny Harries, who many of the public will be familiar with as Deputy CMO. And, of course, Professor Paul Cosford, who is Emeritus Medical Director at Public Health England, and a truly excellent official, one of the best I ever worked with. Who are on that group. So there's some good people on there. I think on balance, I would restate my call for the department to recover these functions, and I would refer the Minister to a pretty comprehensive piece of work published just this week by Policy Exchange, examining how a new deal for public health can build a healthier nation. They call for the creation of a new Institute for Health Improvement, housed in the Department of Health, reporting directly to ministers and the Chief Medical Officer for a new funded national mission to improve the health of the nation. There's a lot of sense in that, and I recommend the report to him. Let me just dwell for a moment on that word funded. I have to say, Madam Deputy Speaker, I don't think, and the record will show that I was always lukewarm at best on this idea, the government should proceed with the idea of the end of the ring fence of a public health grant. I think it would be a mistake. I think that should be kept. I think it should be measured much more tightly, yes. And if anything, I think it should be increased to help our Directors of Public Health do what works towards smoke-free 2030. And I'm not making unfunded spending commitments here, Madam Deputy Speaker. The Prevention Green Paper, which I helped to draft and I still think is a very credible piece of work, talks around the principle of making the polluter, i.e. the tobacco firms, pay, such as they have done in France and the United States, and I think we should progress that to create a smoke-free 2030 fund. So when he sums up, I would be grateful if the Minister could reassure me that the government are at least considering this option and what it might look like in practice. Secondly, the government's ambition, what we call smoke-free, is for a smoking prevalence in England of 5% or less in the next 10 years. But significant action, as we've heard, is clearly needed if we're going to achieve this. I mean, the rate in Winchester that I represent may be 8.3%, but the national average is 14.1%, so there's a way to go. And we know that smoking remains the biggest single cause of preventable death in our country today, and it's a leading cause of health inequalities. The issue is also one of inequality. Around 1 in 4 people in routine and manual occupations smoke, around 2.5 times higher than people in managerial and professional occupations. And this gap has, and I quote, widened significantly since 2012, according to the ONS. And the inequalities are also geographic, as we've already heard today. Now, as a Conservative member, I see becoming smoke-free as a vital step towards delivering our manifesto pledges to extend healthy life years by 5 to 2035, reducing inequalities across the board and, as the Prime Minister calls it, levelling up every part of our country. However, as the Green Paper concluded, this is an extremely challenging ambition for any government. The All-Party Group on Smoking and Health has recommended a new tobacco control plan, focusing on delivering that 2030 ambition, which seems to me an eminently sensible suggestion. So, given how long it takes to get a tobacco control plan, even with making promises at the box, has the Minister commissioned officials to start work on renewing the TCP to set course for smoke-free ambition? I think ministers would be doing that, with smoking prevalence going in the right direction, albeit not fast enough to meet our agreed ambition, but off the back of that opportunity that I mentioned earlier afforded to us by the pandemic. The UCL smoking toolkit does indicate that the pandemic has been a driver of quitting among smokers across all social groups, with the highest rate of people stopping smoking seen in the last 13 years. There's the good news. I don't think, though, we can be complacent, Madam Deputy Speaker. Although many people have quit, that is true, there are signs that some have relapsed to smoking, and in particular there are worrying signs among the 18 to 24-year-old group that smoking rates may be increasing again, and certainly have stopped declining. So turning to the alternatives, if I may. The UK has long been a leader in traditional tobacco control measures, such as the use of taxation, as we hear at budget time, the smoking ban, of course, which was to great credit to the Blair government, plain packaging, and readily available smoking cessation services, as well as numerous tobacco harm reduction policies using less harmful alternatives to smoking. I was often criticised in office for both promoting e-cigarettes too much and for not promoting them enough as an alternative. That suggested to me that I may have had the balance about right. But I will go further. Data from the ONS tells us that over half of smokers in this country want to quit, and that on average, smokers try some 30 times or more before giving up successfully. Of those who are successful, only 2% quit through stop smoking services, and over 40% use an e-cigarette. But while many have quit using vaping, the fact remains, and we can't deny this, that nearly half of smokers in Britain have tried vaping but didn't stick with it. On top of that, the figures now show that the number of vapers is falling, and some 1.3 million vapers haven't fully made the switch and still continue to smoke at the same time. Now, obviously, since the early 2000s, tobacco policy in the UK has been driven by the European Union through the Tobacco Products Directive. That is about to change. So, can I ask the Minister to speculate, as I know ministers love to do, on what opportunities Brexit bring to advance our leading role as a tobacco harm reduction advocate? We may be leaving the political structure of the European Union, but I sincerely hope we are not leaving our leadership role in this area, where many, many countries around the world look to see what the UK does. Also, our Prevention Green Paper pledged, and indeed I did when I was in office too, and I quote, run a call for independent evidence to assess further how effective heated tobacco products are or are not in helping people quit smoking and reducing health harms from smoking. Now, the government has said that the call for evidence for this would be announced in summer of 2020. We all understand, of course, why that has slipped, but I wonder if we might get some reaffirmation of that today, because recent word, including a written parliamentary answer to my honourable friend the member for Broxbourne, who I know wanted to speak today, on the 21st of September, says the government will merely, quote, consider looking at this at a later date. I think it's imperative that the government recommit to holding that call for independent evidence, Madam Deputy Speaker, as soon as possible, so that effectiveness of heated tobacco products can be assessed and smokers can have confidence they're switching to a less harmful alternative. And I say that because there is growing evidence that adult smokers' misperception of the risks surrounding vaping may be preventing smokers transitioning to less harmful alternatives. Last month, the excellent UK charity Action on Smoking and Health, otherwise known as ASH, which campaigns against smoking, run by Deborah Arnott, published survey data showing that vaping in the UK had stagnated as a percentage of the total smoking population after year-on-year growth. And the charity blamed what it called unfounded concerns about the relative safety of e-cigarettes as a likely cause. Given public health authorities in the UK actively support and champion vaping as an alternative to smoking, that statistic shows how damaging inaccurate media coverage can be, I would attain. So to maximise the public health benefits of e-cigarettes, I think regulations should be risk proportionate and reflect the scientific evidence base on the relative harms of cigarette alternatives and their potential for harm reduction. For example, when this Parliament's Science and Technology Committee, chaired so ably by my right honourable friend, the member for Tunbridge Wells, reviewed the scientific evidence on e-cigarettes, it recommended that government should move to risk-proportionate regulatory environment where regulations, advertising rules and tax duties reflect the evidence of the relative harms of vape products compared to combustible cigarettes. The UK government has invested a lot of resources to understand the science behind these products, which I think has informed a pragmatic and progressive approach that successive governments have taken to vaping regulation over many years, and the results have been impressive, suggesting it would be quite a strong regulatory model for other countries to consider. And given competing public health priorities, of course I appreciate it's not as simple as it sounds, but I believe we should dedicate sufficient time and resource into understanding the science around vape products and the potential they have to improve public health. And that's why I would like to see us recommit to what it said in the Green Paper that I wrote, partly. And just to say, will the government consider increasing the age of sale up to 21 from 18? I think it could be useful. From 16, sorry. I think that could be useful in the toolbox. And I know Ash has suggested the government should consult on that as a means of reducing youth uptake. The call has been backed by over 70 organisations, including Cancer Research UK, British Heart Foundation and the Royal College of Physicians. I think that it's well worth considering. So in conclusion, Madam Deputy Speaker, we should keep the ambition. We've never been short on the ambition across the last government, the coalition government and this government. We should tighten and update the plan to bring it in line with the ambition in the Green Paper. We should stick to what we know works and be honest enough to say what doesn't. We should fund the directors of public health around what does work, and I've given a suggestion as to where I think that can happen. There's a lot riding on getting this right, Madam Deputy Speaker. There's a lot of people's lives that depend on us getting this right, and I think we need to do so for their benefit and for the next generation, so that we don't see another generation of young people weaned on to the damaging lifestyle that smoking can lead to. So there's just a few ideas there. We look forward to hearing the Minister's response at the end of the debate. Thank you, Madam Deputy Speaker.
Jim Shannon.